Thank you very much for this opportunity. On behalf of myself and Guido, we would like to thank the Hellenic Association, to all of you, to the President, our friends from Greece, and to Izu for this opportunity. Uh, it's wonderful to be here. This is where the Western civilization began, so it's my first time, but I promise it won't be the last time. Uh, I'll start with the EAU, the ethos of EAU, and how we should all get ourselves involved, the juniors involved, and how we can all benefit from being a part of EAU. EAU has really grown over the last decade or so. There are now more than 16,000 members, and they are spread, as you can see, all along the globe from different parts, not just in Europe. As it happens, we know mostly about guidelines, but we don't know sometimes that it is in lots of languages, more than 30 languages, and it's endorsed by almost 60 national societies. Of course, there's the European Urology, but now there's European Urology Focus and the new journal, which is the European Urology Oncology. So it caters to all needs and all tastes. So it is not just about randomized trials, it's about a lot of different things in oncology, in endourology, in infection, in andrology. So a lot of different papers are coming through, some very, very high impact papers. If you look at what else happens, there's a lot of patient information leaflets that has been done again in different topics in more than 17 languages now. So that covers things like nocturia, that covers simple things that patient wants to ask, and going through a range of different topics like stents, ureteroscopy, and so on. Education is in the core of what EAU does, and that includes online education, events like these, where you have people coming in to benefit from lectures, sometimes live surgeries. There's also learning resources. I know a few people in the room here who we were involved in the endourology section to make the module for urolithiasis so that people can go and learn from that. Scholarships, I have benefited myself from a scholarship where you go to another center and all of you can benefit. And you're paying for the EAU, so you should try. If you feel you need to have a scholarship, it's very, very worthwhile doing that. It's a great experience to go to some other center and you always learn something new. Maybe it's about the technique, maybe it's about how they do things differently, maybe it's about what you shouldn't be doing. So it's always worth taking advantage of that. Obviously, we want the EAU to be easy to be pan-European, of a very high quality. It should be unbiased. That's what the literature aims for. You should look into the latest developments. And of course, then there are the experts who give their expertise, both in terms of surgeries or their opinions on key issues. Dr. Palau is the chairman, but there are lots of members from broadly all over the Europe. And there are more than 200 experts and opinion leaders and more than 60 experts on laparoscopy and endoscopic surgery. I have been a part of Europe with Guido for last 5 years. And the hands-on training that happens there is a lot of effort. So a lot of expert faculty are available. And hopefully at some point, ISU can also do hands-on training courses here. And all the presenters score very high in terms of the evaluation rating. Online education, of course, there are e-module courses, surgical education, webinars, and that interaction allows more than 28,000 participants to be a part of it. That includes urologists and nurses. So there's lots of opportunities there. The courses, the new e-courses on broad range of topics, that's thromboprophylaxis, of course, prostate and bladder cancer, renal cancer, urolithiasis, and again, that portfolio is increasing. So again, if you're not sure, there are lots of e-courses that will help you, that will guide you, teach you, and you can benefit from that. The webinars, there's one every month, but there's also KOL, key opinion leaders, who have the recorded talks. The surgical education platform is very, very broad. That includes endoscopic stone treatment, which we were a part of making it, laparoscopy, robotics, and then hands-on training, of course, on robotic surgery, laparoscopy, diagnostic work, functional urology, and endourology. So again, a lot of things happen around surgical education. Lots of meetings. This is slides from Europe. This is very close to my heart because we spent 6 days non-stop working, maybe partying sometimes as well, but it's very enjoyable. So you should encourage all your residents to come to Europe. It's free, it's for 5 days. They not only learn, they also meet lots of other European residents, which is very, very good in interaction and trying to make friendships which last long. I know so many of my great colleagues and friends just through being a part of that. And courses happen everywhere. You can see, I mean, that flag keeps popping everywhere. This year with Andreas, we were in Russia, in Siberia to do an EZU course. We have been to Czech Republic, we have been to Poland, and lots of other places. So it's not just in the core in the Western Europe; it's everywhere, and it's also spreading. As you can see, there are dots in Australia, there are dots in China, and everywhere. So EZU courses are not just for Europe. And of course, there's master classes on everything: BPH, prostate cancer, lasers. There's one on lasers that happened recently here in urolithiasis, and lots of other different things. So again, this caters to everybody. It is not just for an endourologist or oncologist. Even transplant surgeons can come to it. The section meetings happen in close collaboration, and of course there's lots of different sections that include the robotics section, the research section, the andrology section, and so on. And again, if you have an interest in it, show your interest, and chances are you can contribute through being a part of the section. Everybody is welcome there. I mean, the weather will be just like here, so you don't have to worry at all. It's a great place to be. You must all come to the EAU in Barcelona. Surgery in Motion is again a new tool to see some recorded, pre-recorded surgeries for online, as an online resource. And as I said, scholarships, I have benefited. It's wonderful. You choose a center, you get the resident to choose, and now they've also got a visiting professor program, so even senior people can go. Choose a center, choose what you want to achieve, make a proposal, and a lot of times, more often than not, it will be successful. But unless you try, you don't know. Only EU members are eligible. So if you're not a member, or if your junior colleagues are not members, they should be members. And what does the membership give? It's free access to the guidelines. 3 journals now, not one. Previously it was 1 journal. Now there are 3 journals for free, and there's access to lots of scientific content. And of course there's discount on EAU meetings and courses as well. And what most people don't know, the membership you pay, if you're planning to attend EAU, it more than pays for that. So the discount you get from attending covers for the cost of membership. So actually, you're better off being a member if you want to go and attend the EAU conference. So please join us. There's lots of ways to follow us. Please join us and make EAU and EZU even more strong. Thank you.